Well, did you know June is National Dysphagia Awareness Month? So dysphagia means it's difficult for some people to swallow food. So we spoke with the chair of the Department of Communication Orders at Marshall last week about children and dysphagia.
But this morning I caught up with her about how it affects not only children but also adults, and there are some signs you can watch for. We're continuing last week's discussion now about Dysphagia Awareness Month, and this week we're going to speak with Ernay Adams. She's from the Marshall Speech and Hearing Center. Good morning, Ernay. How are you?
I'm great, Sarah. Thanks for having me.
Well, thank you for being here on Studio 3 today. So I know last week I was gone, but we discussed dysphagia in children, but I know it's something that adults can have a difficulty with. It's a difficulty with swallowing.
Yeah, so adults can have dysphagia just like our pediatric clients that we see. As adults, we swallow up to 900 times a day just to manage our own saliva and during eating and drinking. So you can imagine the impact that dysphagia can have on someone's daily life.
Wow. As you're sitting here telling me more about it, I'm thinking about how many times I'm swallowing. So who do you see exactly if you have dysphagia?
Okay, so we'll go over signs and symptoms, but if you're having any of those signs and symptoms, you're going to see a doctor first of all. It's important to be aware of what's going on when you're swallowing, and then the doctor will refer you to a speech-language pathologist, and we are actually the experts in caring for people who are having swallowing disorders.
I jumped a little out of order. I apologize, but if you're having a symptom where you need to go to the doctor, what are the symptoms you would look for? What are some of the signs of dysphagia?
Yeah, so dysphagia can occur in 3 different areas. It can occur in your mouth. It can occur in the throat, or it can occur in the esophagus, which is our food pipe, or any combination of the 3. Mm-hmm. So if you are starting to experience frequent coughing or throat clearing during meals and snacks, or if you are noticing that you are avoiding foods that you previously enjoyed, maybe watery eyes or runny nose when you're eating, if it feels like something is maybe sticking inside your throat, and also recurrent pneumonias or an unexplained weight loss. So dysphagia can lead to aspiration, which can cause pneumonia, and that's a pretty huge problem. So we want to make sure we're tackling all of those things if we suspect any difficulties.
It's very serious. So what kind of tests can be done to rule out dysphagia? Because I'm sure it's a symptom that you'd see in other things as well. Yeah,
so if you see any of those warning signs, you go to the doctor. They'll refer you to us, a speech-language pathologist, and we are skilled in many different types of testing. One such test is a bedside swallow, so we would just give you different consistencies of food, and we would observe for any of those warning signs that we talked about previously. That's not ideal, though. Ideally, we want an instrumental exam where we can actually see in your throat and see what's happening. Many of the hospitals in our areas offer modified barium swallow studies. They're great tests, and they're basically an x-ray of your swallow. But here at Marshall University Speech and Hearing Center, we offer a scope of your swallow. It's called FEES, and it stands for Fiber Optic Endoscopic Evaluation of Swallowing. It's actually a very simple test, and we can perform it here. There are 3 of us on staff who are skilled in this type of evaluation. And we actually received the training at Vanderbilt in Nashville so that we could bring this service back to the tri-state area.
Oh, that's wonderful that we have a local service like that. So I know we're talking mostly about dysphagia this month, but we also heard it's Alzheimer's and Brain Awareness Month. Can you tell us a little bit about what the Speech and Hearing Center is doing for those types of things?
Oh, of course. So I feel like every time we come on here, we have another group to advocate for, and we're so happy and pleased to do that. So SLPs are also very involved in caring for people with Alzheimer's and dementia and other cognitive impairments. So next week, we are offering a free virtual education class. I've teamed up with 2 students, and we have prepared a great presentation for people who have been diagnosed with dementia or their caregivers. We're going to provide some basic information about dementia. We're also going to talk about the SLP's role in caring for people with dementia, and also hopefully give you some take-home tips that you can implement on that day as soon as you're finished with our course to hopefully help make the process a little bit easier. for you. And because it's a virtual event, we will need you to RSVP so we can send you the instructions for logging on to our event.
Well, Ernay, thank you for all the information, and thank you for being here today on Studio 3.
Okay, great. Thank you so much.
I think that's so great that they have some kind of event where if you can't bring them in, or maybe you don't, want to take that next step, you can help treat your loved one yourself.
It'd be good to know about signs and symptoms, or
sure.
if you're wondering if somebody has it, because I mean, imagine not being able to swallow, just very frightening. And even if you're starting to feel that way, definitely check it out. So if you want to go to that event, or you want to attend virtually, RSVP to Ernay Adams. Her number is 304-696-3644, or you can shoot her an email at ernay.adams@marshall.edu.
And it's also time for WSAZ.